Hello and welcome to the first ever episode of Leading Health with Dr. Attom. I don't know why, but I was really apprehensive, but also really excited to start this channel or new podcast or whatever you want to call it. It doesn't matter. Over the last sort of 18 months, I've been thinking, I really want to start this, but I never got the opportunity to do so. Actually, I kept telling myself, I'm too busy, I've got work, I've got research. But finally, I decided that no, I need to actually get over that last massive hurdle and start. And so here we are. Over the next few weeks, months, and years, possibly if you subscribe and you keep connecting, we are going to explore together how we can actually develop better healthcare leaders, how we can get them to connect with other leaders around the world and build up a really strong healthcare ecosystem, not just in one country, not just in two countries, but I really want to do this on a globalist scale. So I hope you're going to connect. I hope you're going to engage, and I hope you're going to be here for what I'm visualizing is going to be a really cool journey. So I started my healthcare journey in 2008. And since then, I have built up a really holistic overview of the interactions and the sort of healthcare ecosystem. And so the reason why I really want to do this channel is so that I can connect with multiple levels of this ecosystem. At the individual level, I want to connect with individual people, with patients, people that are interested in healthcare and leading healthcare. At the organizational level, I want to connect with healthcare organizations that want to, come together and think about how we can further improve healthcare and lead healthcare in a really effective way. Stakeholders, I want to be able to connect with stakeholders from all over the world, bring them together so that we can discuss some of the key areas that, we need to improve in relation to leading health. Maybe if they're even listening or I manage to connect with them, what about policymakers? I want to be able to connect with policymakers as well and see how we can improve policy around how we lead healthcare. And finally, and probably most importantly, I want to connect at the international level. I want to be able to connect between and within different countries. I want us to build up an international healthcare leadership ecosystem so that across the globe, we can interconnect and build up this community in which we can discuss and come to some sort of evidence-based solutions on how to move healthcare and leading healthcare forward. So I really hope that you guys are going to stay tuned. This is the first episode channel. So what I wanted to really do was just to give you some context into why I started it and where I think we can go with this. So what happened was in 2008, I was really broke, didn't have much education, and I was looking for a job. So I managed to find this ad in a newspaper and it was for this healthcare role. I applied for it. They gave me a call. I ran down there, literally, had an interview and I got the job. And they said, all we need is someone that wants to learn and someone that wants to interconnect. And I was like, that's me because I don't have anything else. So after a few days, what I realized is that on reflection, not at the time, but only on reflection, that I became subconsciously really fascinated with healthcare and how healthcare operates. I decided to take some vocational courses just to get a bit more context. And very early on, I would say within the first 2 or 3 months, it really dawned on me just how complicated and how complex healthcare really is. And that was the beginning of the journey. So, what happened then is, obviously, I went off to university and I did a B.Med science degree. And that gave me a really critical insight into healthcare. I focused a lot on healthcare management. And by doing the degree, what I managed to sort of glean from it was a really good educational understanding and appreciation of healthcare and how complex it really is. Just as I was finishing my degree, I was so fortunate to get a fully funded PhD to do healthcare management. And this was when things got really, really deep, because I realized that I not only had the sort of practical experience through my work and the educational experience through doing a sort of degree, but I now had, in addition to that, from the PhD, the sort of philosophical underpinning of why healthcare and leading healthcare effectively is so, so important. So that was a really massive moment for me when these three elements sort of came together. And I came up with my key philosophy, which I have followed ever since, which was this notion of research and practice. How can we consistently bring research and practice together to get something really, really powerful? And I think that is the underpinning ethos for this particular videos that I'm going to be doing. When I was doing my PhD, what actually happened was I decided to create a new research group. I called it very creatively the Working Group. Now I know the underpinning ethos of that working group was, how can we bring researchers and practitioners together to actually discuss really, really important issues. And I was so fortunate as well, because my management school was amazing. They gave me funding and we put together lots and lots of different events. We were able to bring people together from different perspectives to discuss really important topics. And I suppose this new channel is a continuation of that, but at a global level. So what happened was, just as I was about to finish my PhD, I got a full-time job at a university, and I started lecturing. I really, really loved it. And that sort of gave me another angle in terms of healthcare leadership and management. At the time, just as I was finishing university and finishing the PhD, I was again so broke. So it was so nice just to have a full-time job, get some coins into the pockets. Amazing. So everything was going well. I thought, oh, this is amazing. Then all of a sudden, the pandemic hit. And that's when things just went from one direction to the next. Because in that chaos, in that really crazy tragedy, which it was, I also changed my direction in terms of my research and where I was going to focus all of my energy. I realized just how important emerging economies are when we're thinking about healthcare in all contexts, but especially when we're thinking about how we lead healthcare. So what then happened was, during the pandemic, I did some traveling to visit family. And during that period, I got a first-hand, real-world experience of emerging economies and what healthcare meant within those different contexts. This was really, really big for me personally, because that was the first time I came face to face with some of the key issues around healthcare management and how better healthcare management can really improve services. I made a really big decision at that point. I switched from my current, what I was doing then in terms of my research, to pivoting and focusing more specifically on international healthcare and international healthcare management and leadership. And I think that was what really galvanized me. That was what really got me thinking, okay, then I need to do something big. In 2020, in the middle of 2020, I funded and I put together my first international research project looking at healthcare management, healthcare leadership, healthcare digitalization. So it was an international research project in multiple emerging economies in Africa. Really, really loved it. It just opened up my eyes in a way that I was like, wow, there's so much here. And we finally, analyzed all the results, some really, really powerful results. And what I did actually at the beginning of 2023 was I was traveling again. I was fortunate enough to be able to open some really tight doors, get inside, and have important conversations with policymakers. So I was able to share a proportion of my findings with policymakers and also with international NGOs. I did some presentations, we had some engagements, and we're still having those conversations. So that was really, really amazing for me, and something that I'm going to be sharing in more detail in subsequent videos. So what I've also been doing is I started up my own healthcare startup, right? Very crazy. But the startup came directly from my own personal experience of traveling around the world during the pandemic, engaging with different healthcare organizations, both for my sort of PCR personal use, but also for that sort of consultancy work. In addition to that, the startup is also based on my international research. So the research that I did in 2022. So what I did was just bring everything together and think, okay, then what crazy idea, what needed insight do I have from everything I've done, and how can I put that into something that can be useful to others? So that's something else that I've been working on over the last sort of 12 months or so. And I'm really excited to share that with you, hopefully sometime soon. Over the last 7 months, I have also been on my own healthcare journey. About 7 months ago, I got a really, really persistent and very annoying eye infection. And over time, that eye infection led to other things. And so I've been going to different types of healthcare organizations over the last sort of 7 months. And it's been a really strange experience. For the first time, I'm having to experience healthcare from the other side. Up until that point, I've worked in healthcare, I've done research in healthcare, I've studied healthcare, but I've never used healthcare on a sort of long-term basis. And so that was really weird. What was even weirder was about a month ago, I was in a healthcare organization that I had previously done research in. That was a bit strange. And then 2 weeks ago, I was actually seeing a consultant, and we got chatting. And one of the questions was, "So what do you do then?" And I just sort of, I just looked at him and just smiled. I was like, "Oh my god!" Anyway, we had a really cool conversation, and on reflection, as I'm starting this new engagement, I feel like I have that sort of rounded experience now, where through unfortunate circumstances, obviously I've had to use a lot of healthcare organizations over the last 7 months. But when I think back to, other things I've done, like my startup, doing all the lecturing, doing the international research, doing the PhD, studying healthcare, working in healthcare, which I think is probably the most important. I've built up this insight from multiple perspectives, and what I aim to do over the next, as I said, weeks, months, years, is to engage with you guys at the individual, organizational, stakeholder, policy, international level, so that we can interconnect and we can build up that community that I think is going to be so powerful and very, very needed as well. So that's it, guys. Thank you so much for listening to the first ever episode of Leading Health with Dr. Attom. Please subscribe, like, leave a comment. If you found this video useful somehow, maybe not at all, still leave a comment. And we are going to be engaging over the next few years, hopefully for a very, very long time. So guys, let's keep connecting. Let's keep engaging, and let's keep exploring how we together can lead healthcare and make it more efficient and more effective for everyone internationally. Thank you so much. All the best.